Welcome to our Mentor Talks podcast. Through the podcast, we invite mentor figures throughout New York City and beyond to be interviewed by students and young adults, enabling next generation viewers and listeners to benefit from their insight, experiences, and knowledge. Hi, my name is Julia Yoon, a student at Drexel University.
I'm Yunho, a graduate of Baruch College and program coordinator at Korean Health.
I'm Chan Min. I'm a rising senior of Stuyvesant High School.
And today our guest is Dr. Laura Kim, Director of Urogynecology and Reconstructive Surgery and Assistant Professor of Clinical Obstetrics and Gynecology. Welcome, Dr. Kim, and thank you so much for joining us today.
Nice to be here. Thank you for inviting me.
So to start this off, I have some introductory questions. What do you love about your career?
So, generically speaking, I'm a physician. So when I was little, that is something I wanted to do, to help people. It's a very generic sense, but through things going on in family, I think helping people in a medical sense was a calling, and specifically for women. There are many immigrant families and women that need healthcare and don't really know how to access it and or know how to describe it. And my subspecialty is a very taboo topic. It's urogynecology. So we help people with urinary incontinence and prolapse, which are topics not discussed in polite conversations. However, many women are affected by this. So that's kind of the reason for going into medicine and the current, career path that I have, where I'm helping take care of part of the women in Queens. We have the largest immigrant population here, so.
Yeah, so how did your undergraduate and, if applicable, your graduate education prepare you for your career?
So I actually knew I wanted to go into medicine early on. And so I actually did a combined bachelor's and medical school degree at Boston University. They have a combined 7-year BA and MD program. So I didn't really have to worry about pre-med courses and then the MCAT and then having to apply. You're able to actually explore non-scientific, majors. So like my minor was in medical sociology. And I think in high school, volunteering as part of an ambulance corps, a volunteer ambulance corps, and being a basic first responder, and then doing other activities not medically related, being part of student government, mock court, those type of things to see if other things would be interesting are also helpful in kind of figuring out, is this for me? Is this something that I can do for the rest of my life? So I think those are things that can help kind of prepare and guide you in this type of career.
All right, then what undergraduate and graduate programs would you recommend for medicals, I guess? So
right now, the trend in medicine is to find well-rounded people, because one of the things that I think we've discovered is it's not just about the science. There are many different types of patients and backgrounds, and there's different aspects to medicine. It's not just the healing part or the surgery part, but understanding the bigger picture of humanity. So, when people are asking about medicine as a career, it isn't just biology or psychiatry or, being that type of, in quote, major in undergrad. It is about following your passion. And that's actually what a lot of the medical schools are looking for, is what is your passion and how does it relate to medicine? What can it add to that? So, one of the examples in like our current OBGYN class, we have a former ballet dancer. We have somebody who is an Olympic swimmer. So not really a pre-med thing, right? But they followed their passion and showed perseverance and a willingness to achieve. And then they bring those aspects of their non-medical lives to patient care. There are members who are LGBT, and so they're able to relate to those patients potentially better, or understand the hardships that patient population can undergo. BIPOC populations also, have barriers in accessing care. And when you see people who reflect who you are as a patient, it enables patients to be more comfortable and more willing to seek care, and it helps physicians to connect with them. So when you are thinking about an undergraduate program or a major or a school, it's not really about that. It's about the bigger picture of developing as a person and then excelling in whatever you want to do. Because even if you're doing finance, there's a lot of financial stuff going on in healthcare. Even if it is English literature, there's a lot with writing and comprehending people's emotional states. So that's what I mean by doing what you love, finding the passion for it, and then it will apply itself to the medical profession. Does that make sense?
Yep.
And so that creates a good leeway into the next set of questions about your social impact. And so what kind of impact does your career have on people in society?
So I'm hoping things like the KoreanHealth.org program is able to allow people to access healthcare. I think because my passion is to help women, it's to help non-English speaking immigrant women, trying to think of ways for them to access care is a societal impact, because it's not just taking care of that one patient, but women are the connectors in the family. So if mom is sick or if grandma is sick, they're usually the glue that keeps a family together multi-generationally. And when they are sick or not getting the preventative care they need, you start to see the breakdown in that family, right? And when you are able to treat that one person, you're not really treating that one person. You're actually keeping a family intact. And then that has an effect as a whole, right? If mom is coming for routine well women care and is found to have a cancer that is then treated, you're keeping that family whole and avoiding some of the devastating consequences of having mom pass away, or being more sick for a longer period of time. And it's because you have an entryway into the healthcare system and then it branches out. Does that make sense? And so society, sometimes for the greater good, you treat one, and that one person has a network web of people that they affect. And then that network has another set of people that they affect. And that's how I think one person doing one thing and, affecting those web members can help branch out and help society.
And so what kind of volunteer work related to your career, if you have any, have you performed for the community?
So I did a lot of medically related volunteer work. So things like in undergrad, I ran American Red Cross blood drives for our undergrad dormitories. So we would have over 1,000 units of blood donated in a year, which is a significant amount of blood for the local hospital systems. Again, like I mentioned, I volunteered as a basic first responder in our volunteer ambulance corps. And then later on in medical school, I participated in things like our outreach program for the homeless in East Boston, volunteering at women's shelters at Rosie's Place. And these are all different aspects of the human condition, as well as how we can affect people's health without actually having to be in the hospital or in the doctor's office. And then later on, over the years, there are multiple health fairs, which is where physicians volunteer their time and their clinical expertise to meet with uninsured or underinsured patients and give them clinical advice on certain disease processes. So for example, in Queens at Flushing Hospital, there was the annual health fair in conjunction with the Korean Nurses Association of New York. In New Jersey, Holy Name Hospital had a Korean Asian health program that expanded to a generic Asian health program. And patients would get free blood draws for cholesterol screening, blood pressure checks, diabetes. And then for things like women's care, women would come and ask about why do they need XYZ type of preventative care? Where can they get it? Or they would have questions about things specific to my subspecialty in urogynecology and what are the things that they can do, because there's many conservative things that people can do to start initiating treatment so that their quality of lives are better, so they could work more comfortably before they're able to access the healthcare system. And then during COVID, I was part of a coalition of physicians, KDA, the Korean Doctors Against COVID-19, where we ran antibody testing sites. And this is during March through June of 2020, where we didn't really have any tests available. Everybody was just told to quarantine. And so we ran over 1,000 antibody tests for people in Northern Jersey and in Flushing to know if they were exposed to COVID, if they were exposed and positive in the early phase of their disease. We reviewed how to quarantine in small spaces to educate the population in the hopes that those 1,000 people would then spread that knowledge to their family members and their friends. So, these are all volunteer activities with not necessarily a Urogyne approach. However, it does impact our community and our community's health. So those are some of the volunteer activities that I've done, along with the KoreanHealth.org health directory.
That's great. And so from your experiences with the volunteer programs, which of those would you recommend to the next generation?
Again, I think it has to match your calling and your passion. I think KoreanHealth.org is a volunteer opportunity for the younger generation where they can kind of explore multiple facets. It's not just medicine, but aspects of accessing medicine, delivery and content information, creating websites. There's so many different aspects to that website that you can develop different facets for your skill sets. If you are interested in specifically a certain type of healthcare, for example, women's health, volunteering, now that we have this Roe v. Wade decision by the Supreme Court knocking it down, there's a huge movement in trying to make New York City a safe haven, which it is, and then to provide access and care. How are these women going to get here? How are these women going to be housed here? And what are the lobbying aspects that we have to do in Albany to make sure that those patients who come here are safe, the physicians who provide that care is safe, and that's through our national ACOG organization and our section. So if you're interested in women's health, that would be a wonderful opportunity to see how you can get involved at local as well as state versus national levels in advocacy for women's healthcare. If you're interested more in, just healthcare in general, but you don't really know like what exactly you want to do, many hospitals have volunteer activities or offices where people will go and volunteer in different parts of the hospital and do different types of duties. And that's very helpful for exploring, healthcare. And healthcare is not just the physician. Healthcare involves the entire team, right? Nursing, like Tanya's mom, they provide a tremendous amount of bedside care. Right? And the careers that nurses go through, it's not just bedside care, but through management and upper administration. In our organization, nurses, are able to get advanced degrees, MBAs. They can, be head of outpatient directories. We have mid-level providers like physician assistants who provide bedside support and surgical support. There are occupational and physical therapists. So each of those aspects of care, there are always volunteer activities that, if you're interested in to explore, are available so that you could see, is this what I'm interested in? Is this patient population what I'm interested in? Some people have an interest in addiction and homelessness and those issues, or domestic violence. And so we have like the Korean American Family Services for domestic violence and for patients to get help and outreach in that way. We're volunteering in homeless communities and shelters and figuring out if that is something that you're interested in. So many different avenues, and it's not just about medicine. So, all of these are actually wonderful ideas and possibilities for people to explore. Think outside the box, okay? Asian Americans, Korean Americans, what are the 3 things you're allowed to be? My generation was doctor, lawyer, accountant, finance, right? And that is the way like we were raised. But your generation has so much more opportunity through social media, the internet, to find them, to find interests. So, if you ever have a question, asking somebody, we have a lot of these different networks, company, ACAM, CAMA, which are Korean American physician communities, even in New York City. They are good resources to ask regarding volunteer opportunities or shadowing opportunities with different physicians.
Thank you. That's great. A lot of great, helpful advice. I have a few questions about skills, internships, and resources. What do you think are the most important skills needed for your career?
You mean specifically to medicine?
Yeah, for your like your field, women's health.
I think perseverance is actually really important. When people decide on medicine, it's not just the hours to get through your undergrad course studies and then your medical school studies. It is also the perseverance that's needed during residency training. As a young person, you have life experiences and that's your background. And when you start clinical practice, you now come in contact with so many other people and so many diverse family situations, social situations, domestic situations. And sometimes it's really not easy, when you encounter sexual abuse, domestic violence, child abuse, and being able to kind of persevere through those type of situations and learn from them, and curiosity of how can we make things better? Is there a better way to do this? Is very important. And then residency training, right now we have in New York State at least an 80-hour work week law. So you're expected to work 80 hours a week. The average job is a 40-hour work week, right? So as a resident, you are working 80 hours a week. So persevering just physically, stamina-wise, mentally, through many, many years. So I did 4 years of residency and 3 years of fellowship of doing that. And this was before the 80-hour work week. So we're doing 90 to 100 hours a week. So being able to persevere physically, mentally, knowing how to de-stress is actually really important. Learning now when to say no, okay? Because if you're pulled in 10,000 different directions, you can't get it all done. It's impossible. You'll try, but it won't be possible. And as you get a little bit older and further along in this path, you realize that you can't say yes to everything. There has to be some boundaries, and knowing what your core values of who you are and what you hold important is really important. Because when people ask you to do XYZ, or you need to do XYZ, if it doesn't mean something to you, and it isn't part of your core values, it's probably something that you should not do. You know, a lot of the times people go through an automatic motion of just doing things, and knowing that information about yourself is really helpful in kind of stratifying what to do next. I hope that makes sense.
Yeah. Are there any specific programs or internships that you recommend?
So if you are interested in high school, in medicine, these programs are like the combined 7-year BA/MD program at Boston University. If you Google combined BA/MD programs, there's some that are 6 years. Sophie Davis has a program, I think that's 8 years here in the city. Albany Union had a 7-year program. There is a smattering of those type of programs available for interested high school students. So that would be one thing. So if you know early on, like middle school, that medicine is the way to go, then making sure that you really truly want to be a physician is really important. So try everything else and make sure you don't like it, and that medicine is your calling, because these programs are looking for people who really know what they want to do for the next 7 years of your life, which is kind of hard for a high school person to make a decision on. And in undergrad, there's actually many undergrad programs where you can apply as a second-year undergrad to a specific medical school. So Williams College has a program with Mount Sinai, where you can apply as a second-year undergrad. Boston University has a program for second-year undergrads to apply directly into medical school at that time period in their undergrad life, as opposed to later in their liberal arts, as well as engineering school, to be accepted. And the goal of these early acceptance programs is to develop more well-rounded physicians who are interested in something other than medicine. So again, that whole being well-rounded outside of the scientific field is important for that. And they're trying to encourage that, to take the pressure off having to be a biochemistry engineer major to get into medical school. So high school and undergrad, those are opportunities. And then if you are interested in research, then majority of the medical school departments, if you contact their office, depending on the department you're interested in, will have the department administrator and a residency program director. And a lot of these programs have research requirements for residents and attendings who have research interests. So if you inquire there, is there somebody interested in having a volunteer with XYZ skills? Then you can get information about research projects that you can get involved in. So for example, at NYC Queens, where I work, we have the Lang Center for Research, and they have research volunteers working there, people who have finished their undergrad, foreign medical grads who are studying for their USMLE exams, who then volunteer or are hired to be research coordinators or program assistants. And they're also looking for volunteers to help do the data mining or the data collection for a lot of these projects. So if you're interested in that aspect, looking for those departments, which you can Google at all of the major medical schools and any of the major residency programs, they will have a point person who can then guide you on who to contact next.
So let's talk about your workplace. And first question is, how did you get your start?
Start in medicine or start in Queens or?
Start in medicine, I think, yeah.
So, like I mentioned before, if you are interested early on, doing activities that challenge you in that regard. So for example, like the volunteer ambulance corps, you needed to take overnight shifts. You could do 24-hour calls to see if that's something that you're able or willing to do. Being involved in high school in things like Model UN or mock court, those are ways to see if you enjoy that topic, or doing like the business club. Really exploring outside of medicine is important so that you can rule them out. Because whenever there is a tough time in medicine and you're like, oh man, did I really want to do this? Do I really want to sacrifice all of this time and energy away from my family and my friends? Knowing that you had kind of already done that legwork of process of elimination is really helpful. And taking a gap year between high school and college, or between college and graduate school, may also be a good idea. That is not an idea that existed when I was growing up. It is definitely something more that as a parent, our friends with kids that are older are discussing, so that students can explore all of their other options to really know what their passion is. And I think that's really important. Is this truly your passion? Is this your calling? Okay. And then that will lend itself to opportunities to then get you to the next step.
Okay, then what obstacles did you face getting started and during your career?
I think the obstacles are a little bit different in medicine than in other fields. Other fields, it might be getting that job. It might be getting promoted. In medicine, it is getting into medical school. It is getting into your residency program or the type of medicine residency program that you're interested in. But once you're in those programs, you need to finish. And I think a challenge that I saw in a lot of people, and even with myself, was, is this the right field? When you're doing 100, 110-hour weeks, sometimes you doubt, is this really what you want to do? Does it make sense? And, like I mentioned previously, perseverance and really knowing what your core values are important in those situations, so that you can overcome those obstacles of doubt when you're physically exhausted and sleep deprived, to push you through to get to the next step of your goal. And having clear goals and knowing that they're truly your goals. They're not somebody else's goals. Helps you get through those obstacles. Because if you're doing it for somebody else, because of your parents, or because you think it's a good idea, it sounds like a good idea, it might not be enough. Because right now, at least for physicians in training, the demands and sacrifices that are expected when you're in school, when you're a resident, and when you're a fellow in training, is to really put everything above yourself and make sure that that patient is taken care of, whatever it takes, which means it's at a detriment to yourself, right? And if you don't have your core values and you know what you want, and you're doing it because you know you want to do it, and this is what you want for your future, those obstacles, will stop you. And that's why there are people who start medical school and then they realize it's not for them. People who start residency and they realize it's not for them and they switch to a different specialty. And the earlier you're able to figure that out, the more beneficial it is. But sometimes you just don't know until you go through it.
Yeah. So what was the single biggest factor in achieving the success you wanted?
I think success is a very vague term because at every point in your life, that definition of success changes, right? So, in high school, what's the definition of success? Graduating and getting into the college or program that you want, right? So, back then it was keep your head down, study hard, do the activities that you need to do to make sure that this is what you want to do the rest of your life, right? So things like all the volunteer activities to verify that medicine was the goal. And then later on in residency and in fellowship, again, setting those goals of, is this really truly what I want? And then persevering and again, just going through the steps that needed to be done to get to that finish line. So again, the themes of perseverance to get to your goal, which is your goal, not anybody else's. Does that make sense?
Yep. And well, then what is the best and the worst thing about your career?
I mean, the best thing about my career is this is kind of what I feel is my calling, right? For my professional life. And I know that if I help one person, it's not just that one person. It is their family. It is their cadre of friends. Because usually in the stuff that I do where women don't really talk to other women about it, they feel very isolated and alone, even though it affects 50% of women in menopause. 1 in 2 women are affected by, pelvic floor issues, and yet it is such a secret. And by treating one person, then they talk to their friends and they realize, oh, I'm not alone. There are actually things that can be done. On the flip side, the worst thing is it's very hard to have a work-life balance because just as important is your family, or at least to me, it's my family and my children, and not being able to spend the same amount of time and energy with them and trying to find that balance, that is a forever struggle. And it doesn't matter if it's in medicine. That I think is for anybody in any profession, whether it is any career, any job and family, and trying to find that balance. That not being able to do both at 100% because you only have 100%. There's only one pie. You don't get 2 full pies, right? And trying to figure that out is always difficult.
Okay, and my last question for you will be, where do you see your industry in 5 years?
In 5 years. So I guess in 5 years, part of my interest is in quality improvement and outreach for non-English speaking patients. And there is an inherent systemic bias against non-English speakers in getting care. And even when they are in the healthcare system, they receive a lot of information that's all very English-based. And so they're not able to optimize their care for things like medications or post-operative care management. And trying to kind of overcome some of those challenges in my patient population, I think will then hopefully branch out to the system as a whole so that we can have better quality improvement and access to care and therefore health equity for patients who are non-English speaking. My parents were immigrants. I am a child of an immigrant. And the community that I work in is predominantly immigrants. And it is something that, we talk about medicine as a whole, but for immigrants, it actually is a very difficult thing to access. And when you access it, to actually then be able to carry through because of the language barriers and difficulty in things like educational materials or even discharge instructions. So hopefully in 5 years, we can improve our system and do some quality improvement for that.
Yeah, and I know I just said it was the last question, but part 2 of that will be how about in 10 years then?
I'm sorry, say that again?
How do you think about your industry for in 10 years then, instead of 5?
So in 10 years, it'll be 2030. So there's a Healthy People 2030 push in the US government where they are trying to improve health equity and healthcare access in women's health. It's to improve maternal morbidity and mortality because our outcomes are terrible when it comes to pregnant women and postpartum and delivery complications due to social determinants of health that isn't delivered in the hospital. Things like socioeconomic status, ability to get to your doctor's office, ability to understand your appointment reminder, the ability to buy healthy food so you're not diabetic hypertensive, the ability to afford medications if you do need it, because just because you have a card that says you have health insurance doesn't mean you can afford the copays. So this 2030 Healthy People push by the NIH, one of our government entities, is gearing a lot of medicine's push towards this quality improvement to providing not just care, but better care, by using metrics. And to see, especially in New York City, where we have such a diverse population, socioeconomically, linguistically, culturally, it's a huge challenge. But I think in 10 years, hopefully we'll have shifted the needle a little bit towards that, so that we will, as a society, have a healthier population. But healthcare systems are gearing towards quality improvement for specifically those purposes.
Thank you. And so the next set of questions talk about mentors and networking. And so did you have any mentors from your experience that helped you throughout your career?
So I came in contact with the healthcare system very early because of family member illnesses. And so the physicians that took care of my family member also knew I was interested in medicine and were very helpful in guiding in regards to, is it worth doing a 7-year program? Should you just go to a regular undergrad and go through the whole pre-med application processing and the weed out process with those coursework, or apply to something like a combined program where that's kind of, if you get accepted, you don't have to worry about. So those physicians, I think, have been very helpful. I went to Catholic school in Queens, and we had some sisters who were chaplains in hospitals, and so their viewpoints on religion, humanity, health, I think, also colors how I see patients and how I believe healthcare should be delivered. And then in medical school and residency and fellowship, there are individual, physicians in the fields who had mentored me regarding research or directions to think about, or encouraged persevering through and not quitting, to encourage you to get to that finish line. So it's not just one person, it's really an entire network of people that you encounter. And actually every person that you encounter could potentially be a mentor. It's not like a magical group or a magic person that is a mentor. It's somebody that you feel like you can discuss, who may have a similar background or a challenge that can advise. And then sponsorship, which is different than mentorship. Mentorship is when they help you with their experience. Sponsorship is when somebody kind of volunteers you for a job. That's kind of like a promotion. So currently in my current job, I've been fortunate to have sponsors who allow me to participate in kind of like academic leadership training and leadership coaching to kind of develop those other skills, so that can then help other physicians that are in the next generation of physicians that are coming on board. So, networking, getting to know the people around you, but also I think working hard, demonstrating that you're willing to work helps in that whole networking and sponsorship process. And then if you are, again, like passionate about something, being involved, not superficially, but really being involved to get to an end product, an end goal, I think is really important, because it's very easy to start, very hard to complete a project. And so when you're doing projects or activities and speaking with mentors or sponsors, completing that project, I think, is really important and helpful. And then that will then bring your network and make it bigger, because they'll say, oh, I work with so-and-so on this project, and I work with so-and-so on that project, and I think that'd be great for the next project. Does that make sense?
Yeah, so I guess more specifically, how did you yourself develop that network?
So it was reaching out to people who had similar either research interests, career interests, like subspecialty interests, and working with them. The other thing is speaking with mentors about what opportunities I may not be aware of that I should think about applying for. So ACOG is the American College of OBGYNs. It's our national OBGYN association. And one of my mentors from residency, who I currently work with, recommended and that I apply for, a vice chair position in our section. And so, working in that environment has now opened up the door to other projects. So I'm now part of a menopause task force for BIPOC populations. And, what is the research behind it? How can we present it? What is the knowledge deficit in both physicians and patients, and how can we improve it? And we're currently developing slides to be presented at our district meeting in September. That will then lead itself to possibly other opportunities and other networking opportunities. But again, this is what I mean by starting at point A, meeting people, and then completing the project to then meet more people. And it eventually branches out. I can't remember who said it, but overnight success takes 15 years. So it is something that is, slowly gathered over a period of time. It is not that you join this group and then poof, you have like this magic network of like 500 people. But it's developing those one-on-one relationships that then become 2, then 3. And with the whole 6 degrees of separation, you'd be surprised at how connected everybody actually is. And it's not just in medicine, but to other fields as well. So I think that's one way to grow your network. And then being open to people outside of your normal social group of friends. People are always talking about connecting with people with small talk, which is a skill that in our generation, when you're laying low, it's very hard to develop. But being curious in order to create connections outside of your interests is important. So then those side branches develop. So for example, if you're interested in the arts, it may have nothing to do with medicine, right? Or maybe it does. Art is used as therapy. Arts and marketing and graphics is used in social media. We need to communicate better in healthcare to the masses, and we need to get more involved in social media. So now you have to find somebody who can visually communicate the technical information in medicine. So in that case, knowing people in both healthcare as well in the arts is really important to then have a final product like social media outreach and infographics and marketing skills to then reach an end goal. Does that make sense?
And so the last question of the section is asking about people you specifically modeled your career after, if you have any.
I think it's the opposite. It's people I did not want to model. So in medical school, I was interested in surgical subspecialties and women's health, but that actually isn't just in the field of OB/GYN. There's actually many different ways you can be involved in women's health through internal medicine or general surgery and breast surgery, in oncology, urology and female urology. But encountering specific personality types or how patients were treated or how physicians treated other physicians of other subspecialties or within their own group kind of eliminated a lot of other subspecialties, because back in the time when I was training about 20 plus years ago, all of these fields were pretty much male dominated. OB/GYN was about 50-50, but even back then for the surgical subspecialties, there were very few women. So it was very difficult to model after a female, because a lot of the females who were in surgical subspecialties were single. They were not moms. They didn't really have families because they had to choose career or family. There wasn't this idea of being able to do both. And when you saw the other surgical subspecialties of who was there and knowing that you would have to be with these people and they would be your family for 80 to 100 hours a week, if you couldn't get along with that personality type, it would be a very long, miserable residency. And so in the end, OB/GYN was chosen because the personality of the people that went there, the types of patients that we take care of, made the most sense. It was the best fit. And so, there were many possibilities, but figuring out what I didn't want actually helped me discover what I really wanted. And that's how I kind of modeled my career. And it's a very new subspecialty. It's been around it's only been an official subspecialty for about less than 10 years now, in terms of being boarded. So it's great to be on something new, cutting edge, or maybe not so cutting edge, but it also means that you don't have any specific role models, but generally what you want to do. Again, knowing your core values, that is really helpful in helping guide where you want to go.
Thank you. So just to wrap things up, I have a few questions left. Did you ever have any doubts about your choice of career?
So I did not, because I knew I wanted to be a physician at age 4. And because of my encounters with the healthcare system, I knew that that's what I wanted to do. I wanted to get people better because I could see the interconnectedness of treating one person and it benefiting more people, like the surrounding family. OB/GYN was definitely a tough residency, and there were definitely many obstacles in terms of not just physical exhaustion, but also the psychosocial, emotional component of it. People think that when you are an OB/GYN residency, it's all about delivering happy, healthy babies. And instead what you saw was patients were really sick, really, really sick. Some on the verge of dying, trying to make a decision. Do you deliver mom early and let the baby have a worse outcome, or do you keep the baby in and you potentially have a worse outcome with mom? Or patients who present with fetal demise and the grief that those patients have, or seeing a child sexually abused and having to do a rape kit. Those are all very emotionally tough things to process in general. And sometimes when you come across those really tough cases, you're like, is this really what I want to do? And sometimes patients, they pass away. So again, is this what I want to do? And those are kind of the moments where we go back to this whole core value. What you want, not what other people want for you or what you think other people would want, is helpful in determining, do you go forward or you don't? Because there's everybody who's gone through residency, they have those patients, they have those moments, and then that's when they make the decision to continue or not.
Where do you see yourself in 5 or 10 years?
Hopefully better able to do work-life balance. Right now my career path, takes me away from my family. So hopefully in 5 to 10 years, I'll have some better idea of how to balance it so that I can spend more time with my kids and my family. Hopefully in 5 to 10 years, maybe I'll ever meet that metric goal of being an associate professor instead of assistant professor. And hopefully by then I would have mentored some more residents and had a chance to see them develop and grow in their career, mentoring them. So baby steps, doing what you want, caring for the people that you love, and trying to be able to have it all. Not ever possible, but a goal, hopefully in 5 to 10 years, that's better balanced.
Okay, so the last question I have is, what's the number one advice that you have to give to the next generation?
I think it's really finding, it sounds so cliche, but finding your passion. It really is. And it's been a recurring theme in this entire discussion, because we actually do a lot because we think it's what is expected of us and not necessarily because we want to do it. And sometimes we're so tunnel visioned into maybe believing what others would want for us that you don't actually self-reflect about what is important to you, what is your want, and what are your specific goals. Because I think that's very important when you're deciding not just on medicine, but for any career path, in order to kind of ultimately have your happiness at the end. Our parents had worked hard and immigrated to this country because they wanted the next generation to be better, to be happier, to be more successful, whatever that definition may be. But you can't ever get there unless you truly know yourself and your wants. And it sounds like such a vague thing, but it's actually a recurring theme when we talk about career progression, overcoming obstacles, and then trying to develop leadership and then guiding those under us. Because those questions about self and passion and core values kind of underlie what you're willing to do, what you're not willing to do, and what will give you happiness versus burn you out. So in order to be happy with your career or where your life is, reflecting on who you are as a person, what is your wants in life, writing it down, and then reflecting once in a while, I think is really important, because sometimes we just get so busy following all the details and making off all the check boxes that you don't actually reflect. And then look back at that core values a few years later, a year later, 2 years later. Is it the same? Is it different? We change as we get older, but usually our core values don't change. It's just how we approach it. Right? So, it's not medicine specific, but I think that would be, the important advice. And what I hope I can help instill in my kids is for them to discover what is important to them and what would make them happy, because then that would ultimately lead them down whatever path that they choose for their life.
Yeah, that's great advice. So that would conclude our Mentor Talk interview. Thank you for joining us, and thanks again to Dr. Laura Kim.
Thank you for having me. Hopefully it's been helpful, and feel free to contact me if you have any questions.